I understand you've been feeling quite fatigued recently. I'm going to carry out a range of checks just to make sure everything looks okay. Alright, good. So I'm going to start by taking your temperature. Okay, so I'm going to pop it in both of your ears first, then on your forehead. Okay. Alright. Other one. And your forehead. That's all good. Write those down. Can I have an index finger? Either. Okay. So this is just going to read your pulse and oxygen levels, okay? So just relax for me. Oxygen levels are perfect. And see your pulse is dropping a little bit now. It was a little bit high. There we go, it's stabling out. Good. Right, if I can have your wrist. Let's see here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Perfect. Okay, great. All looking good so far. So I'm going to have a listen to your chest, alright, my love? That's better. Okay, if I could just get down your top a little bit. Thank you. Just normal breathing. Take a nice deep breath in, hold it there, and release. breath in, out. In, out. Breath in, out. Okay, I'm just going to check around the back. Okay. Normal breathing. Okay, that's fine. It's all nice and clear. Your lungs sound fine, and your heartbeat sounds fine. Okay, that's fine. So, okay, lovely. Now I'm just going to watch your breathing for a second, okay? Can I just place my hand there? Okay. Okay, that's fine. Okay, good. I'm going to do your blood pressure a little bit later. Alright, so what I'm going to do is just observe your face to begin with, okay? So you can just sit naturally. You're looking quite pale. Are you usually quite pale? Your eyes underneath are a little bit shadowed. Is that normal? So your eyes are watery. Maybe it's a bit pale as well. I will need to pull down, but I've got to put my gloves on for that. Okay. Skin doesn't appear to be stressed or anything. It looks a little bit dehydrated, but I can't see any obvious signs of stress. And your eyes, you don't have any puffiness. It's literally just like the shadowing. It's not quite dark circles, it's quite pale. Yeah. Okay. Look at your lips. A little on the dry side. Okay. Dry lips. Can you pop out your tongue for me? Okay. Just roll it up. Okay. Can you just show me your teeth? I'll have a look properly in your mouth a bit. Okay. You can relax. Let me just look at your posture. You normally quite slouched or... okay. Okay. You seem a little low today, energy wise. Do you feel it? Yeah. So how long have you been feeling like this? Yeah. Okay. Do you have any pain anywhere? Yeah. Okay. Okay. So would you say you're just kind of getting worse rather than better? Yeah. Okay. Right. Okay. Now if you just look at my finger, okay? Now with your eyes, if you could just follow it, okay? Keep your head nice and still for me. That's it, just your eyes. Good job. Okay. That's fine. Now, can you look at my light? Look at my light. Okay, I'm just going to look in your eyes. Just look straight ahead for me. It's a bit bloodshot, aren't they? They always like that. You do look quite tired. Just look at my nose. Okay, pupils may be a little bit slow. Let's just try with this slide. Okay, look straight ahead. Right, yeah. Okay, so reactions slower. Okay. Eyes. How much sleep are you getting at night, my lovely? Okay. And you're still feeling really fatigued. Okay, so you're feeling lethargic, obviously fatigued and drained. Also low. How's your mood? I know you say you feel low, but what do you like doing tasks day to day? Are you thoughts of, say, having a shower, brushing your teeth? Do they feel like too much effort? Yeah. Okay. Okay, so simple tasks are right. No, you're definitely not lazy, my lovely. No, don't let anyone tell you that. You're not lazy at all. You're clearly struggling. All right, and you need some help, and that's okay. All right. Some of these could be, maybe linked into depression, but could be also linked into like chronic fatigue syndrome, maybe even fibromyalgia if you're experiencing some pains. Yeah, there's definitely something not quite right. Yeah, I mean, simple tasks are not just that you can't be bothered, it's they feel like too much and you just haven't got enough of that. Yeah. Okay, so that's not you being lazy, that's just you've got a problem. All right. As you said yourself, you never used to be like this. All right, and you even said that you want to do those things, but you don't at the same time, if that makes sense. I totally get what you mean. Yeah, I get that. Yeah, okay. All right, my lovely. I am also wondering if we are lacking something, so I will be taking a blood test shortly. Yeah, I am wondering whether you may be low on iron and vitamin D, especially because you are quite pale and under your eye area. We can see that a lot with anemia. That's why I'm definitely checking your iron. And obviously vitamin D can also kind of make us feel like this, but in some cases your bloods could be fine and you're still feeling that way. People with chronic fatigue, fibromyalgia, they feel exhausted, drained, lethargic, fatigued, and just pretty much all the time. I know that sometimes things are worse than others, and for somebody it might be such a minimal task, but for you it's not. And you've described to me extreme fatigue. Yeah, and those symptoms, are not just because you can't be bothered. All right, my lovely. Okay, so please don't ever feel that way. All right, it's definitely not you just being lazy and can't be bothered. There is something clearly not quite right, and your body's telling you to slow down. Okay, you do look drained. You look absolutely drained, exhausted, and so tired. Yeah, I can just see that just by looking at you. What's your diet like? What kind of things are you eating? Yeah. Yeah, quickness, yeah. Okay. Okay, what about any exercise? Okay, so you like to walk the dog? Okay, lovely. Yeah, I was going to say, afterwards, I bet that takes a lot on you. Yeah, do you do that every day? Or okay, have you got somebody? You have, okay, that's fine. If you want to do that, then go ahead. Do what you can, little and often, okay? If you feel like you can't do it that day, let somebody else do it. All right? If you feel like you want to give it a go, give it a go. But we do need to kind of take into consideration that you could have a knock-on effect. It's like, for example, you know, with fibro, you might want to go into the gym or you want to do some tasks, and then the next day you feel like you've been rammed through like a hedge backwards, and you know what I mean, and you feel like heavy and pain, tired, exhausted, drained, and you just can't put your finger on it. It's kind of like that. Yeah, not necessarily the pain, but it's the tiredness, the fatigue right the way through your body. Is that exactly? Yeah, it is. Yeah, so that to me is, it's definitely, I mean, you could have low iron, but what you're describing seems a lot more intense than that. Yeah. Which is why I'm thinking chronic fatigue or something like that. So just remind me, pains anywhere, whereabouts? Yeah. Right, okay. And this has been going on for over 6 months now, so this is definitely more of a chronic issue rather than just something. Now, about 6 months ago, I'm guessing that's when you just started to notice things were becoming a problem. Okay, so around that time or before, did anything significant happen to you? You know, did you get an illness, like COVID? Did you have like the flu, anything like that you can recall? Okay, so not, you can't quite remember. You don't think so? Okay. Okay. All right. Yeah, with your food, just do what you can. All right. If you've got somebody with you, that's fine. That can cook and help and things. All right. Don't worry about that. But just eat what you can. I mean, from what you've said, you do have quite a balanced diet. But what kind of things do you drink? And how much of that? Okay. Okay, that's fine. I mean, that's pretty good, my love. Yeah, try and add in, if you can, some orange juice and apple juice. Just a little bit, you don't need a lot. Maybe just like a little bit like that, and just, you know, maybe once or twice a day or something like that. Just give you a bit of an immune system, a little bit of a boost. And that will also help with the vitamin D soak into you a lot better. All right, so I'd recommend that for you. Alright, so I'm just going to have your hands. Can I just check your fingernails? Okay, let's squeeze. Okay. I'm just checking your circulation, my lovely. It seems to be fine. Do your hands or feet ever feel really cold? Okay, that's good. So you're definitely slightly dehydrated, I would say, from the look of your lips, okay, and your tongue. All right, so that's indicating that. Your skin, by looking at it, it does look a bit dehydrated. Now, you are drinking some water, but it's not ideal. All right. So we can try to increase that a little bit as well. I know it's easier said than done. Maybe if you just add a little bit of squashing or something like that, that would be so much better than having none at all. Okay, so a little bit of dehydration. Okay, so I'm going to do that for you in a second. So blood, so I'm going to check your iron, vitamin D, general health markers, and I'm going to check a couple of other things. So this is just going to help rule out conditions and, you know, show things if there's anything wrong and if there is, I can treat it. But I am thinking you do have chronic fatigue syndrome, my lovely. All right, but what I will do is obviously put everything together when I've got your bloods done, and then we can have a chat and go from there. And if I do need to refer you on to anybody, I can do that as well. All right, so what I'm going to do now, my lovely, is do a blood test, but before that I'm just going to check your blood pressure. Okay, my love. So if I could have that on. Okay. Lovely. Okay, so I can get your arm in there. That's it, like that. Okay. Blood pressure is perfect, my lovely. All right, which is a good sign. Lovely. Okay, so just get that. Okay, what do you like with blood? Okay, let me just have a feel. Let me have a look. I'll try this one first because just go like that for me, my lovely. Okay, I'm going to get some gloves. Right, okay. Take a couple of tubes today. Okay. That's that. Right, we have a feel. Oh yes, that's wonderful. Put my gloves on now. Okay. Okay. Right, so let's clean the area. Okay. You can stop pumping, just keep a fist, okay? Wonderful. Okay. Okay. There we go. Okay, sharp scratch. You can release the fist. Wonderful. Good job. Press that down for you. Good job. Okay, now would you press down for me? Thank you very much. Okay, so that was fine. Just right that on there. Is that done? And let me just have a look. Ah, perfect. Wonderful. So that is your blood taken, but what I want to do now is have a look in your eyes. So I'm just going to pull down, okay? Oh yes, definitely. Okay. Very pale indeed. Interesting. So there's definitely something not quite right. I'm just going to pull down and put my light. Yeah, very, very pale. Okay. Now I want to have a look at your mouth. Just get my okay. So light. Open wide. Okay, press down with that. Say oh. Okay. That's that. Let me have that. Wiggle your tongue. Roll it up. Okay, I'm going to pull down and have a look at your gums. When was the last time you went to the dentist, my lovely? Okay, might be worth getting a check. Because your gums are looking a little bit red, a bit inflamed. Okay. I was going to keep those on, but no point now. Okay, so okay. Right. Okay. So that's your check complete, and your blood's obviously done. Now, try to stay hydrated as much as you can, alright, and try to get as much rest as you can, alright. Get rid of all this guilt and worry about being lazy or anything like that, okay, and just do your best. Okay, that's all you can do, is your best. Alright, so just try to stay consistent with a sleep routine. Alright, stay hydrated, especially through the day. Have balanced meals to help support your energy, and obviously just light movement, a little bit here and there to try and, you know, just help things a little bit. Okay, there's a few things obviously that have flagged up that are concerning to me, hence why I have carried out the bloods. But even if they are treatable, say with iron, etc., I am still wondering if you have got chronic fatigue syndrome or something like fibro. But because you're not really complaining so much of chronic pain, that is where I come back to the chronic fatigue. Alright, but what I would like you to do is do a diary for me, okay? So I want you to sort of monitor, you know, the times that you get up, when you're napping, how long you slept for, what was your sleep like, what have you eaten, what have you drank, that kind of thing, what exercise you've done. And I know it's a bit tedious, but if you could do that just for a week for me, and then if you can come back and see me and we can discuss the blood test results and I can read over the diary and then we can go from there. How's that sound? Okay, so if I can book you back in, that'll be fantastic. Okay, so let's see when I can get you in for a follow-up. So a week's time. Well, ideally face-to-face, but if it's inconvenient I can call you or do a video call. Yeah, I'm trying to see what I've got. Okay, I can do a week today, but the times are quite limited. I've got like 8:30, 9, or 4, and last one I've got about 6. Okay. There we go. Okay, you'll get a text in a moment to confirm that. Perfect, got it? Wonderful, great. So I will see you in a week. Okay, now please take it easy. Do your diary and do the recommended, and we'll have a chat next week. All right, and just remember, okay, you've got this and you're not lazy. You're struggling, and that's okay. All right, don't forget that. Okay, take it easy and get some rest. You take care now. Bye-bye.